what can the average person, regardless of whether they need medical attention right now or not, do to help ensure that we don't slip backwards from where sadly it took a crisis to kind of get us at least moving forward in the right direction?
Well, I'll tell you what, providers and patients' voices at a local and national level are very, very moving. Lawmakers need to hear about what we need and what our experiences are in our communities. And lawmakers not only need to know it, but they want, I believe in my heart that they want to know it. Now, Danielle, you had referred to this resource that I directed you to, the Center for Connected Health Policy. It is a really wonderful resource. It's federally funded. Their whole mission is to track telehealth legislation in every state and at a federal level in this country. So if you want to know what legislation currently exists in your state as it relates to telehealth, you can go there and see that. If you want to know during a legislative session what telehealth policy has been introduced and currently moving through the legislative action process, you can also see that. And I would tell people, when your legislative session in your state is about to come around the corner, take a look at what legislation has been introduced and is going to be coming forward. And you can actually track that at a state level. And as a member of that state, as a resident of that state, you can actually go testify in favor or against legislation that makes sense or doesn't make sense. And, I really encourage people to get involved. There are so many things that we, can impact and advocate for. And this is one of them that impacts, the potential for impact is so broad when we can push such legislation forward. Or write a letter to your legislators and let them know why they should support or deflect certain legislation.